The purpose for Chrome Guided Smile is for patients who are edentulous, that's got missing and broken teeth, that doesn't want to deal with removable appliances anymore, find it difficult to smile in front of the camera, or their eating habits have changed and they can't eat the food that they used to love, but wants to increase their oral health. So for clinicians that do get into Chrome Guided Smile, they do have to be comfortable with surgeries. Chrome Guide is not for the clinician that has not got into surgeries before. This is definitely your more advanced clinician. These surgeries are pretty complex. They can go for training. There is facilities and there is avenues that they can follow, that they can get local or international. They can get training, and they can rely on the support and a mentor. So Protec's role with a Chrome Guided Smile starts with the case planning. Through the planning of the case, the clinician will definitely be overseeing it. All the information will be shared with the clinician beforehand, and they got to sign off on it. Protec will do the whole design. We'll do the smile design. We'll choose what will be the best outcome for products to be used. That's when the conversation will go, what will be the best for this patient. At the end of the planning, and when we have all the information, the CBCT scans and the impressions, if we have all the relevant information, the clinician can then with confidence be able to place the implants. The clinician will know where the implants is going, what the conversion is going to look like. At the day of the surgery, we will be there to support the clinician. We will be there just as an advisory or guide. For Chrome cases, it is not a less invasive surgery. Normally with Chrome cases, there's a lot of bone reduction that will happen at surgery, a lot of flapping of the soft tissue. At the end of the day, when the patient walks out of the surgery, it will be a full conversion. Could be only in one arch, or it can be both arches can be done at the same day. For patient outcome, the recovery is faster because it's a more predictable surgery. The conversion is done in a day. That's a precise fitting. It's an easy conversion. It doesn't take a lot of time at the surgery to do the conversion. The recovery is pretty fast for the patient. Less swelling. They have a prosthesis that is fixed. These patients can function as normal again, as what they did in the past. The success rate of Chrome is extremely high because of the predictable planning that was done beforehand, placing of the implants in the right positions, the angles. Everything is brought up to tissue level with the multi-units. There is after the prosthesis has been delivered, the patient's is easy cleanable. Soft tissue adaptability is extremely high. The outcome for on these cases is very predictable. For the clinician, when they get comfortable with Chrome, there is a learning curve to it. But when they're comfortable with Chrome, it will make the process, the surgery, faster and more predictable. They will see that the day of the surgery is smoother, more predictable. It will give a stronger outcome for a conversion, and the outcome, they do know what the outcome is going to be, because that's already in the planning. When a clinician identifies the patient that they want to work with, that is a candidate for Chrome case, they can send the lab some pictures, and according to that, we will be able to give them a smile design. And normally the smile design will give the patient a very good outcome as what they're going to look like after the surgery. For clinicians that's interested to learn more about a Chrome Guided Smile, we have a team that will answer all your questions and will send you all the relevant information that you need. For clinicians that do have patients that sit on the edge, that They want to educate the patients more. We have patient education available. Patients that's looking for a predictable long-term solution, Chrome Guide is definitely your answer.